Hi, this is Dr. Malapareddy, founder and physician at Sigma Health Direct Primary Care. As a part of our initiative, introducing healthcare resources around our community to our patients and the community in general, we are partnering with Beckner's Counseling, and we have Dylan Beckner, founder and therapist at Beckner's Counseling, today joining us. Thank you for coming in today.
Thanks for having me.
Awesome. So one of the important things for us at Sigma Health and for offering our patients in general is having that care as a center of our care provided here. And care means providing the time that they need and the appropriate treatment that they need. And I always look to partner with the organizations that have a motive around providing the best care that they can to the patients. And in the process, I came across your organization, and it was very interesting to learn the objectives of your organization as well. But for our community, could you please introduce yourself and your organization and tell us more about how you started and where it is now?
Absolutely. Yeah, so I'm a licensed clinical social worker, and I had previously been working at a hospital setting specific to mental health. And in 2020, when the pandemic hit, things were, pretty crazy
Yeah.
everywhere. And I was having a really hard time finding outpatient therapists for my clients that I was seeing in the hospital. So I
Okay.
decided to go out on my own and be able to be another resource for people out there. And I really wanted to be able to do that so that I could spend more time with people. Being in the hospital setting was a little bit more challenging because you're pretty rushed. There's not really a cap on how many people you can see. And it's very quick sessions. So with being able to go out on my own, I was really able to just focus on people.
Okay. Yeah, that's great. And and not only the therapy, there is interesting aspects of therapy that I learned from you. There is unique treatments that you provide at your facility. But can you tell us more about those unique treatments that you provide?
Yes, absolutely. So I'm trained in CBT. I have a couple of therapists who do DBT and other treatment modalities, but myself and Amy, who's at my practice, provide EMDR. So that stands for eye movement desensitization and reprocessing therapy.
That's a mouthful.
It's
Yeah.
long-winded, but it uses rapid eye movements to help process through traumatic memories. And I
Okay.
say traumatic memories because that's what most people know EMDR for. However, it can be used for other things as well: anxiety, depression, OCD, body image, low self-esteem. So there is quite a wide range that we can treat even with EMDR, but it uses bilateral stimulation, so each side of your body, in order to help process through whatever it is that you're wanting to challenge and target. So as you know, with sleep,
Yes.
REM sleep is when we're like processing through all the things that happen throughout our day. We can dream, have nightmares, and this sort of facilitates that same idea while you're awake.
Okay, wonderful. Yes. Sleep, I'm a sleep physician as well. So that helps in the recovery of your entire body, mental and physical. And using those principles when you're awake is pretty interesting and amazing. And it's good to know that those principles can be used not just for trauma and for other mental health issues as well, because I'm a strong believer in using the least amount of medication that you require and using all these other resources, be it lifestyle changes, nutritional changes, and if counseling, therapy. So it's another tool to have in the arsenal to help these mental health issues. It
Right.
sounds like, and that's great.
Yeah,
That's great.
absolutely. We're kind of the same way too. We obviously are not psychiatrists or doctors, so we don't provide medication, and nothing wrong with mental health medication at all. But we think it's super important for everyone to see a primary care doctor as well, just so that you're really looking at the whole person. And then if medication is needed, then that's great, but see what else you can do first.
That's great. That's wonderful. That lines with our modality of practice too. Um, one of the most important pieces that we touched on is the providing the necessary time for our patients to listen to them, to actually listen and provide the treatment that they need, rather than rushing them to the appointment. And it sounds like you provide certain similar kind of the facility or modality at your facility too. So tell me more about your way of practice.
Yeah. So we are not tied to a set amount of time that we have to see each client at. So typically our sessions are around 45 to 50 minutes long. Really just depends on what we're doing that day. But we can also go up to 60 minutes. I even have someone who I just started seeing and we're doing 2-hour long sessions
Wow.
because that's what they're really wanting and they're feeling would be most beneficial, at least for this point in time. So we have that flexibility depending on what works with their schedule, what works with each therapist's schedule, to be able to find what works or see people twice a week. It really just depends.
Wow, providing that kind of time is kind of a rarity in today's practice world, and I'm glad you're able to provide that. And that's the beauty of like these small practices. We are able to make it more agile and serve the patients based on their needs rather than having a fixed schedule or fixed time frame that they have to be seen and sent out. So I'm glad to partner with organizations like that and your organization as well. And I think a big part of this ability to provide the time and the way to practice that you wanted to do, and providing the best care is not taking insurance is a big piece as I understand. Can you elaborate a little bit on that?
Yeah, for sure. I used to take insurance and decided not to anymore. Moved just to self-pay. Again, not being tied to a certain amount of time to spend with each client has been awesome. We're also able to keep things private and not have to have any sort of mental health diagnosis tied to someone's record if they didn't want it to be. We just have a whole lot more flexibility. We're not on the phone calling insurance companies, so then we're able to give those hours back to our clients, which is a
Absolutely.
huge piece. So scheduling is a whole lot easier when you're not working with insurance companies.
Absolutely. I couldn't hold myself back as well. Like, yes, that is such a huge piece of it too. Like we have patients who don't have insurance, but we also have patients who have insurance but choose to have our membership-based practice just because of the convenience that we are able to provide and the amount of time that we are able to provide for them during the appointments. So the overall flexibility is so huge when you're not dealing with these huge organizations and they're not dictating your schedule or time.
Right.
So it was great learning about your practice and partnering with you and your group. Oh, by the way, how big is your group?
Yeah, so there's 4 of us all together, myself and then 3 other therapists, and we do have 1 male therapist, which is hard to come by.
Yes, absolutely. And as we all know, having a male therapist for men, sometimes it can be really helpful, and so is for the women. So I'm glad you're able to provide that.
Yeah.
And your appointment availability is pretty quick at this point, or how quick is that?
Yeah, definitely. We are always scheduling consultation calls that we do for free with new clients, so they can reach out to us, have that conversation, see if it feels like we're a good fit, because trust is a huge piece of this. It's just
Yes.
like what you deal with too with being primary care physician. You want to be able to trust the person that you're really talking to and have that relationship. So we do that first, and then we offer intakes, and we're able to get people in pretty quick.
That is very important to have that trusting relationship, and I'm glad you provide that initial intake without charge. You said,
Right.
oh my goodness, yes.
Yeah.
So that way they're not feeling like they're stuck with somebody.
Exactly.
Oh, that's great. And we do something similar, meet and greet visit, where they can come and chat with me and know our what we're offering before they choose to join our practice.
Awesome.
So thanks for coming today and letting us know about your practice and the wonderful treatment options that are available. You have a great day, and I'll leave her information and her practice information at the end of the video. And if you have any questions, you can put it in the comments, or you can call us at 571-577-6806. You have a great day, and you have a great day as well.
Thank you.
Thank
too.
you.